I'm still waiting for the person with the optimal posture to actually come into the clinic and present in front of me. I've never seen somebody that's absolutely perfect, like straight up and down. And I've been a dance physio for a long time, so like I've got all these beautiful dancers that come in and they're all like this and perfect posture, but they've got flattened butts and arched this and that and the other thing, and they've corrected themselves to try and have that look, but they're not in the optimal posture. So it's one of those things where it's the pinnacle to work towards. The closer that you are to this sort of posture, the less risk you are at having chronic injuries, overuse injuries, those sorts of things, loading up one muscle more than the other. So your muscles will basically work the most efficiently if you are in this posture. Your joints will have the best weight distribution or force distribution across the joints when you're jumping or landing or running. If you've got to shift from one side to the other, you'll basically load up one part of your body more than the other, won't you? And that's how you get that wear and tear. So ideally, the closer that your clients are to this optimal posture, the less wear and tear, the more that body can work efficiently, and the less risk of injury. Okay, so that's why posture is so important for everything that you guys do. It's just like every time you set them up for an exercise or watching them do their cardio work or whatever situation you're in, you've got to try and get them in the right posture. I mean, sometimes it says it's defined by musculoskeletal restrictions. It is. You can't really pick your parents, can you? Like your parents will tell you whether your hips are going to be this wide or this wide, and whether you're going to have bow legs or knock knees. That's like a lot of the cases. It's a bony structure. So to try and change a bony structure is almost impossible. You can't. You've got to try and differentiate between what is a bony structure that you can't have a change on and what is just weakness or tightness. In which case, if you discover that, you guys can have a huge effect on them. It's actually quite exciting because you're like, look how tight your hamstrings are. You're posteriorly tilted, you've got tucked under. I can fix that. We'll get you PNF stretching, we'll get you doing this and that, the other. And then in a couple of months' time, you reassess them and they've improved quite a lot. And that's quite exciting because you've changed the risk of that person for injury. So things to remember are the plumb line goes through. It's called the auditory meatus, or just the earlobe. Like just think about the earlobe, just behind the earlobe there, down through the middle of the shoulder joint. So if you've got your person standing side on and they've got their hands across their chest, just remember when you put the hands across the chest, the shoulder sort of looks like it's coming a bit more forward. So just remember, not everybody has forward shoulders. If you've got your client with their hands across their chest, okay, they might, if they put their hands down by their side, it might actually be in the right position. So something to think about. It's called the mid-axilla line. Do you know the mid-axilla line is basically if you take the rib cage and divide it into half, that's the line going straight down the middle of the rib cage. So if you think about that going down the middle of the rib cage. Then it says in the textbooks, the axis of the hip joint. It's very difficult to know where the axis of the hip joint is by looking at someone, like is it there, is it there? And everyone's slightly different. But you know where your greater trochanter is, that bony bit that sticks out the side there? I think if you just get the line going straight down the middle of that greater trochanter, you can't really go wrong, okay? So I put like a big sticky dot. I find the bone and put a sticky dot on it and find the fibula head, which is a little bony bit just below the knee line there, and put a sticky dot on there. Or if you really mean, just get a texter and just draw it on the person so they walk out with dots all over them. And then the ankle joint, the lateral malleolus on the ankle joint. So if I've got a dot there, and there, and then I get the person to stand up, it's really obvious whether the knees are coming forward, the knees are going back, what's basically happening with the leg alignment. So that's another tip if you can't work out exactly what's happening, just get some dots. Always have a little pack of dots in the assessment room. It's really quite nice. But the head of the fibula and the lateral malleolus, they should actually sit just behind the line. So not everything goes straight through the middle of the line. The legs, they sort of bend back just a little bit. So they should be just behind the line. If you have a knee bent, that will bring the head of the fibula and the ankle forward. So something will be wrong, something will be going on at the knee if you find that the head of the fibula and the ankle is coming too far forward. That actually should sit just behind. a lot of the time you learn, like, what's tight is usually the stronger muscle, yeah, and then what's weak is usually the longer muscle, yeah, and that holds true for a lot of the time. If the longer your muscle is, the more likely it is that it's not very strong, but that's actually not the case in a lot of people, particularly with injuries or with pain. You can have a short, contracted, spasming, tight muscle that's been contracted and sore for a really long period of time, such as piriformis or something like that. But you get that person to do some clams or try and work that muscle, and there's like they fatigue so quickly, there's no endurance, there's no strength, the range is much less than usual because it's not working functionally, like it's just in this grip, contracted, tight. So it's not necessarily strong, like it can't function well, it's just tight, it's short, I should say. It's not strong, but it's just short. Then you can have people like ballet dancers who have these huge, big, long hamstrings, but they can also lift their leg a long way into extension and hold it. So their hamstrings and their glute muscles are actually really, really strong, much stronger than the average, but they also have such good range in them. So you can have a really long, supple muscle that is actually really quite strong, can do a lot of work.